Ever trip on, like, seemingly nothing and then just, like, blame it on getting old?
Happens to the best of us.
Right. Or that frustrating thing when you, like, fumble and you're trying to button your shirt.
Yeah.
Well, today's deep dive, all about why those senior moments might actually be something a little more serious.
Ugh.
We're talking about a spinal cord condition called myelopathy.
Okay.
And before you panic, knowledge is power. We're
Absolutely.
going to unpack this whole thing with the help of a true expert so you'll know exactly what to look out for.
And I have a feeling a lot of you listening will be surprised at just how common these symptoms are
Hmm.
and how important it is to catch them early.
Okay, so let's get right to it. Myelopathy, spinal cord, those are some heavy hitter medical terms. What are we actually talking about here?
So imagine like a kink in a garden hose.
Okay.
The water flow gets all disrupted, right?
Right.
Myelopathy is essentially that, a kink in your spinal cord, often caused by pressure from something like a herniated disc or even just like wear and tear as we age.
So the information highway from my brain to the rest of my body is facing some roadblocks.
Yeah,
That actually makes a lot of sense. But wouldn't I be feeling some major pain or something?
you'd think so, right?
It's my spine we're talking about.
Yeah, you would think so, but one of the tricky things about myelopathy is that the early signs are often really subtle, things that people just brush off as part of life. And that's precisely why we're here talking about it today, because the sooner you recognize those signs, the better your chances of preventing things from getting a lot worse.
Okay. That is definitely motivation to pay attention here. We're talking about like getting ahead of this thing,
Oh,
right? Not waiting until it's a 5-alarm fire.
exactly, yeah. To help us understand those early warning signs, we've got some great insights from a Dr. G. Katsevman.
Okay.
He's a neurosurgeon who specializes in this very condition. Apparently, he sees patients all the time who've been dismissing these subtle symptoms for months, even years.
Yeah, that's what's kind of freaking me out a little.
Yeah.
Like, what if I've been ignoring something serious this whole time?
Let's dive into those symptoms and you'll see what I mean. Dr. Katzevman emphasizes that one of the most commonly overlooked early signs is difficulty with those fine motor skills, particularly in your hands.
Hold on. Are you talking about like struggling to open a jar of pickles? Because I do that all the time.
That's exactly what I'm talking about.
Oh, no.
While there could be other explanations, Dr. Katzman stresses that if you're suddenly fumbling with buttons or having trouble gripping small objects or, yes, even struggling to open jars, it's a red flag worth investigating.
Okay, mind officially blown. Who knew a pickle jar could be a medical test? But seriously, this is why I love these deep dives. It's like suddenly you're seeing everyday things in a whole new light.
Totally. And it's not just about the hands. Another symptom Dr. Katzman sees often, and this one is often blamed on just getting older, is difficulty with balance.
So that feeling of being a little unsteady on your feet, maybe tripping more often, that's not something to just shrug off.
Right.
I'll admit, I've definitely been guilty of that.
A lot of us have. But Dr. Katzman stresses that any significant or sudden change in your balance, especially if it's accompanied by other symptoms like those hand issues we talked about, warrants a conversation with your doctor.
All right, so I've got clumsy hands, wobbly walks. Anything else we should be adding to our is this myelopathy checklist?
Actually, yes. And this one might surprise you. Changes in your handwriting.
What you mean, like my handwriting is getting worse with age? Because let's be honest, mine's been bad since grade school.
I hear you.
Yeah.
But it's not just about messier handwriting. It's more about noticing a distinct change. Like if your writing suddenly becomes much smaller, or you find yourself having to concentrate really hard just to keep your letters on the lines.
Okay, now that you mention it, I have noticed my dad's handwriting has gotten really tiny lately, and he's always complaining about his hands feeling stiff. I'm starting to get a little worried here.
That's why it's so crucial to pay attention to these seemingly minor signs, because what we're talking about here is pressure on your spinal cord. And left untreated, that pressure can lead to more serious problems like numbness, weakness, even difficulty walking.
And this is where seeing a spine specialist like Dr. Katzevman comes in,
Right.
right? He's the one who can connect the dots and figure out if those pickle jar struggles are actually a sign of something more.
Exactly. And you know, so many people avoid going to the doctor because they don't want to hear bad news or they think they're being dramatic. But what Dr. Katzevman emphasizes is that early diagnosis is absolutely key when it comes to myelopathy. He's really passionate about catching it early because the earlier you intervene, the better the chances of actually reversing some of the damage and preventing things from getting worse.
Okay, so that's definitely making me feel a little better. Like, it's not like you find out about this and it's an instant life sentence. There's actually something you can do about it.
Precisely. And this is where Dr. Katsevman's expertise really shines. He's got a saying, we can't always undo the past, but we can certainly change the future.
I like him already, and I don't even like needles. But okay, let's talk treatments. I'm assuming surgery is sometimes on the table. And as someone who freaks out getting a paper cut, how worried should I be hearing the S word?
It's completely understandable to feel apprehensive about surgery, but it's important to understand the goal. In many cases, especially if caught early on, surgery isn't about some big invasive procedure. Dr. Katzman often uses what are called minimally invasive techniques. Think smaller incisions, faster recovery time.
Okay, that's already making me breathe a little easier, but what exactly are they doing in there?
Essentially, the surgery aims to relieve the pressure on your spinal cord. So depending on the cause, remember we talked about herniated discs, bone spurs, things like that. They might remove a portion of the disc, create more space for the spinal cord, or even fuse vertebrae together to stabilize the spine.
So it's like they're going in there and hitting the reset button on your spine, trying to get things back to a point where those signals can flow freely again.
You got it. And what's fascinating is that Dr. Katzman's approach is very much about tailoring the treatment to the individual patient. He's not a one-size-fits-all kind of surgeon. He looks at your specific symptoms, your lifestyle, your overall health, and then creates a game plan that makes the most sense for you.
So it's not just about fixing the immediate problem. It's about getting you back to living, pickle jars and all.
Exactly. And this is something Dr. Katzman emphasizes again and again. Early intervention is key to achieving the best possible outcomes.
Because waiting until things are really bad just makes it that much harder to bounce back, right? It's
Yeah.
like trying to fix a cracked foundation after the house is already built.
A perfect analogy. Early on, when those symptoms are subtle, the damage to the spinal cord might be minimal and surgery might be able to fully reverse it. But if you wait until you're having trouble walking or experiencing numbness, the damage could be more extensive. And while surgery can still help manage the symptoms and prevent further damage, it might not be a complete fix.
So this all comes back to those seemingly minor symptoms we were talking about before. That clumsiness, the occasional stumble, even that stiff feeling. Those aren't just annoyances. They're your body trying to tell you something's off. And the good news is we don't have to just like sit around and hope for the best.
Right.
We can actually be proactive, talk to our doctors, get checked out, and if it turns out to be myelopathy, we can explore those treatment options and get on the road to recovery.
Exactly. It's about taking control of your health, and a big part of that is knowing what questions to ask. Don't be afraid to advocate for yourself. If something feels off, speak up.
So what I'm hearing is listen to your body, don't brush things off as just getting older, and find a doctor like Dr. Katzman who understands this condition inside and out.
You got it. And remember, you're not alone in this. Myelopathy is more common than people realize, and there are experts out there who are dedicated to helping people just like you get back to living their best lives.
This has been such an eye-opening conversation. I know I'm definitely going to be paying closer attention to those little signs and symptoms from now on.
Me too.
Well, on that note, it's time for us to wrap up this deep dive. But before we go, remember, if any of this resonated with you, if you're experiencing those sneaky symptoms we talked about, don't wait. Talk to your doctor, and remember, you've got this. Until next time, stay curious.